Good afternoon. My name is Dr. Ed Jones, and I'm a practicing nephrologist in the Pennsylvania area. And in my full-time job, I take care of patients with kidney disease who are also on dialysis. I'm also chair of Kidney Care Partners, a unique healthcare coalition that many of you are aware of that includes many members that represents constituency throughout the kidney care community. Patients, patient advocates, physicians, nurses, manufacturers, providers, both dialysis and other providers. Very unique industry. On behalf of Kidney Care Partners, I not only want to thank you for coming to this session this morning, but I want to thank you, each of you, for being responsible for and paying attention for the Medicare ESRD program. As you know, there are some 400,000 patients, Americans, who have irreversible kidney disease. Without dialysis or transplantation, they would not be alive. 70,000 patients each year enter the system. There are 1 in 9 Americans with chronic kidney disease. About 500,000 patients with less than 30% of kidney function that are on their way towards dialysis. Unfortunately, many of these patients don't know they have kidney failure. And why is that? It's because we don't have funded programs to identify and educate the patients about their disease and to get them into programs where we know we can prevent and reverse the disease. We need to get the funding for these educational programs. Since KCP's inception, we've been working with patients to advocate for a change in a 35-year-old program that has not kept pace with either providers or patients. KCP's message is simple. One, we need to get funding to have programs to identify patients and to educate patients to prevent and reverse the disease. We need to ensure that patients have access to safe, quality care, that all modalities for dialysis, home or in center, are adequately funded. It's imperative that the ESRD funding be updated annually. Why does the ESRD program have to be the only program in Medicare that does not get an annual update? We also need to ensure that our patients have a choice in their health care coverage for themselves and their families. The extension of Medicare as secondary payer is appropriate and important for patients. Today you will hear from members of the Kidney Care Partners community, including the National Kidney Foundation, as well as patients of our member organization. This is a unique opportunity for all of us to listen to those who are directly impacted by the ESRD program. Each patient today will talk to you about the importance of modernizing ESRD policy. You'll also hear firsthand accounts of how the extension of Medicare as a secondary payer can provide benefits for all patients with chronic kidney disease. And we'll also touch upon the Kidney Care Quality and Education Act, which is a vital piece of bipartisan legislation, and the community's perspective on much-needed reform during the discussions that y'all will be having this entire week that are important to all of us here in Capitol Hill. Again, the need for the education to identify patients, quality and prevention initiatives, and an annual update for provider payments. I'm going to ask John Davis, who's CEO of the National Kidney Foundation, who has been overseeing the foundation through many of the important things that we've been trying to get done for patients in particular. John?
Thank you, Ed. On behalf of the National Kidney Foundation, just let me say we're very pleased to be here today, very pleased to do everything we can to support this legislation and see that it makes it through the Senate and the House and becomes law. We think this is very important. It's our #1 public policy priority for the year. We think it's very, very important. we're really cognizant of the fact that 35 years ago last month, this program began. President Nixon signed the law 35 years ago in November, and we were the first to make a real effort to thank the government for the money. This is a great program. It's been going for all these years, and it has saved hundreds of thousands of lives. It's so important to keep going. Now, that doesn't mean it can't be improved. It can be improved, and we think this bill will improve it. And that's something on behalf of our patients and our organization. We're here to do anything we can to support. We're really basing that on a couple of things. One, we were very impressed with the fact that also last month in the Journal of the American Medical Association, Dr. Levy and Dr. Koresh published an article that stated that there are now 26 million Americans who have chronic kidney disease. We thought it was only 20, but it's 26 million Americans. This is a big public health problem in the United States. And the other thing that we're here to really press upon the Congress is the fact that we think if people are going to come to dialysis, that they should have a planned start. It shouldn't be an emergency start. It should be a planned start. And we think one of the ways to do that is to pass the education provision in this bill where the patients would be able to access education prior to the initiation of dialysis. We think that's critically important so that they are better informed. They can make better choices about their own care. And they will be healthier when they come to dialysis if they've had the ability to receive education, to receive advice from their physicians and other members of the healthcare team as they come toward dialysis. We think that's very important. And our organization has been urging this for several years, and we've been here today and we'll be here as long as it takes to see that that becomes a reality for our patients. The other provisions are very important. As you've heard, we support the entire bill and are very enthusiastic about it. We think it's a very good, commendable thing that the kidney community came to Congress and not only just asking for what we want, but suggesting there might be ways to pay for it. That's something that we thought was important. And so we think that the extension of Medicare as a secondary payer is a good thing, and we think it will be beneficial to patients. We think that the passage of this bill will make a huge difference in the lives of all our patients. It's so important that we're doing anything we can to try to bring that message to the Congress. And since we know what times we live in, if money is needed to do it, we think the extension of MSP is a perfectly reasonable way to do that, and we support it. We think it will benefit patients and allow them to have access to this education, to have more quality built into the programs, and to just make it possible for outcomes to improve, for health to get better for these patients. We've been doing this for 35 years. We can do it better, but it's critically important that this bill pass, and that's why we're trying to do everything we can as an organization and as individuals. And we're having our patients write letters. We wrote 600 letters last week, and we'll write 600 more if it takes that, although, of course, they're not letters, they're emails, but we sent them to make sure that Congress knows that our patients want this to pass, we want it to pass, and we believe that better care is possible. So we're very happy to be here.